Welcome to the community analysis of the city of Altamonte Springs by Eva Paiva. Altamont began developing during Florida's railroad era and was known for the Altamont Hotel and a small commercial center based around Fuller's store. Individuals would come for the healing qualities of the nearby springs while being treated for consumption, later determined to be TB. Tourists and winter residents helped grow Altamonte's commerce from a post office, resort, and community store to an economic center with a lumberyard, theater, pharmacy, grocery store, and more. Commerce further bloomed in the 1970s with the opening of the Altamont Mall as additional visitors came to the area for the opening of Walt Disney World. The commerce in the area has made Altamont a desirable place to live. The home ownership rate in the city is 46.5%, and plenty of single-family and multi-family parcels are available. There is no designated housing for low-income families. It is mixed in with other parcels. Qualifying individuals can receive vouchers to help meet housing costs. While there are no homeless shelters in Altamonte Springs city limits, there are 8 within 10 miles of the city center. A greater outreach for low-income families and homeless individuals would help a sometimes ignored demographic. The resources are available, but access is important. Within Altamont borders, there are multiple places of worship, which include a Catholic church, a Kingdom Hall of Jehovah's Witnesses, the Chabad of Altamonte Springs, and many other smaller denominations. This is a great accomplishment for an area that is not a major city. The city of Altamont does a great job of maintaining its roads. Lynx is a major bus system used. There are private taxi companies as well as volunteers to help with transportation of the elderly. Most residents have vehicles, but individuals who rely on public transportation know the buses run from 5:30 a.m. to 8 p.m. Other transportation must be found for those who work outside of these hours. Altamont has many options for supermarkets that range from organic to low cost to specialty stores. There are also many types of pharmacies, none of which are open 24 hours. Increasing these hours can improve the aid of the community when an emergency arises. Another benefit to the community would be to have a thrift store or a discount store in town. For most of the population statistics, Altamonte Springs is on par with county and state levels. This includes population growth, age distribution, race, employment rates, educational levels, and percent below poverty lines. However, 80% of individuals in Altamonte Springs are white, with the next highest group as Hispanic or Latino at 23.4%. The amount of births is 2 times the rate of the death rate. The lack of diversity in Altamonte Springs is similar to that found in Seminole County and Florida itself, and Altamont has 8% more Hispanic or Latino residents when compared to the United States. But having more cultural diversity is a good thing and can be beneficial to Altamonte Springs. As one surrounds themselves with different cultures, they are more apt to see things through others' eyes, become more understanding, and respect ways that are not the same as their own. With the birth rate twice that of the death rate, there runs a risk of overpopulation. Besides the obvious effects the more people can place on the environment, it can also strain the healthcare systems, increasing risk of diseases. Altamonte Springs is fortunate enough to have a large hospital as well as activity trails and health food stores. Unfortunately, there are some unhealthy things that affect this community as well as others, like fast food, construction, and smoking. The highest communicable disease is chlamydia, and cancer is the leading cause of death in this town. Lowering this communicable disease can mean better health for its residents. A study in Detroit showed a decrease in chlamydia when in-school screenings were performed, an intervention that could easily be implemented. It is a great thing that Altamont has exercise opportunities, as a study in 2017 showed that physical activity decreased risk of multiple types of cancer. This activity can range from home movements such as mowing lawn, playing sports, exercising, or even occupational activities like nurses do so much walking. As previously mentioned, Altamonte Springs has a 383-bed acute care hospital. All people, regardless of ability to pay, are welcome to receive care here. Not all health resources in Altamonte Springs are like that. Long-term care settings accept Medicare and Medicaid, but many are very expensive. These facilities range from $1,000 to $5,000 monthly depending on the services rendered, and those with limited incomes would have a narrow set of options. Home care is more accessible as many insurances will pay for partial or all of the services delivered by home health specialists. If someone did not have insurance, the prices would still be very high. Altamont has 3 ambulatory care centers with varying times, which range from 8 a.m. to 6 p.m. These centers are relatively low cost, but extended hours would help those who work or have families avoid the ER. Since Altamont is located close to a hospital, there are over 15 primary care providers which accept various types of insurance. They hold similar hours to ambulatory care, causing similar time limitations. There is no inpatient mental health facility within Altamont Springs. Getting better access to mental health services would be of great benefit. More free or low-cost access would greatly help the community in a day and age when mental health is so important. One specific objective from Healthy People 2020 would be access to health services 5-1, increase the proportions of persons of all ages who have specific source of ongoing care. I believe having a medical point of contact could help coordinate care with mental health, home health, and specialized care, therefore allowing patients to get more holistic care. This can be through a primary care physician or the Department of Health. Educational community-based programs with the objective of increasing the proportion of elementary, middle, and senior high schools that provide comprehensive school health education to prevent health problems in the following areas: unintentional injury, violence, suicide, tobacco use and addiction, alcohol or other drug use, unintended pregnancy, HIV/AIDS, and STD infections. Unhealthy dietary patterns and inadequate physical activity could be a benefit of Altamont Springs. This could help minimize the spread of chlamydia and other sexually transmitted diseases, as well as dampen risky behaviors. The average weight of Americans have gone up. Altamont Springs is no exception to this. Nutrition and weight status is an important objective, more specifically to increase the number of states with nutrition standards for food and beverages provided to preschool-age children in child care. Small choices begin with children. If we begin to implement these standards, they will grow with them and parents are more likely to join. For the most part, Altamont Springs excels at caring for the environment and it meets the community's needs. The drinking water supply had no violations in its annual water report, and sewage is properly cared for with miles of maintained collection systems. Each household has multiple days for trash pickup and recycling. Specialized items can be scheduled for pickup or taken to a transfer station. Altamont also has a thriving selection of parks, one of which is even a 150-acre nature preserve, the preservation of which is very important to the town. The only downside is the city is not responsible for wildlife. The only exception is for alligators, reptiles, and bears, which are deferred to the Fish and Wildlife Conservation Commission. All other animals, such as raccoons and skunks, may be handled privately. The Altamont Springs Police Department has been working hard to meet the community's needs. They've created joint efforts with schools and participate in town fairs to be an active presence, similar to the fire department, which is also the EMS services. To prepare for disasters and to help the community prepare as well, Seminole County, where Altamont Springs is located, has a 5-goal plan and just recently had a tornado drill. Seen above is the 2016 flyer. There are billboards around town for the most recent one. Evacuation routes are constantly maintained, and up-to-date information on flooding and traffic is available 24/7. Overall, Altamont Springs is making strides to help the community safe in disaster scenarios. Altamont.org is a beautiful, easy-to-use website for the city of Altamont Springs. The website gives an excellent breakdown of each member of government, a short biography, and their contact information. All agendas are available through 2012. The government's budget was easy to locate within the records. The budget is complete and gives detailed lines to explain funding and allocation. A major problem I found with this budget is the city has allocated for a deficit, meaning that they are planning on spending more money than they receive. This is concerning. More information on how they plan to obtain the difference in the monies to prevent debt of Altamont would be an important part of transparency in the government. The City Council has many projects and initiatives in the works to help protect the environment and the most important element in Florida, water. A First is a project which uses stormwater for irrigation instead of using the Florida aquifer or retention ponds. Stormwater from I-4 will be collected, treated, and used. The Altamonte Electric Utility is an initiative to lower electric costs, making it more efficient. Project Apricot began 30 years ago to bring reclaimed water to every residential yard to preserve the Florida aquifer, and Pure Alta is the treatment of the stormwater. There are 4 advanced treatments help to ensure safe water. The most important community goal based on my analysis would be better access to medical services. It is the most important because taking care of basic health needs is a right that everyone should have. This could mean more hours or 24-hour pharmacies. The next is better access to communication about low-income housing. While there are lots of housing opportunities and Section 8 does exist, there doesn't seem to be much knowledge about it. I'd like to see more about how to access it. Housing and health, the most important. Education about risky behaviors. We know about the statistics, now we need to work to prevent these diseases. Discount clothing and consignment shops being available in Altamonte Springs is also important. This is so that adults and children alike of all socioeconomic classes can afford to clothe themselves and to furnish their homes. Next is the environmental protection, because without this, we would leave less for our children. And finally, better access to government. This is last because it is easy to find the information on the website once you know where to look. But I'd like to see more outreach at events to help bring the community together and people would be more comfortable speaking up. If you have any questions, feel free to comment and I'll be happy to answer. Thank you.